Well, thanks so much, Mr. Chair, and thanks to you and the ranking member again for this hearing. And I will add my thanks to Trace as well, and also just note that the good news for America is Trace is representative of his generation, and there are lots of wonderful young people in my state, and I know across the country, really advocating for the mental health of their peers. And in New Hampshire, it's very true. I actually had a 9-year-old look at me one day and say, "What are you doing about mental health, Senator?" And so thank you all for just being the kind of advocates that make a difference. I want to touch on a few topics that have been discussed, but I want to drill down a little bit. Let me start with Ms. Lebarsky. In New Hampshire, a small pool of mental health providers is working overtime to help the growing number of children with mental health needs. And it's just not sustainable. And we've all talked about that. Following up on the testimony you've already given, what are the main causes for this mental health workforce shortage in New Hampshire, and what can we do to help alleviate the crisis?
Thank you very much, Senator Hassan. I think we've all spoken to this very well this morning and now going into the afternoon. It's really the ability for centers to reimburse their staff at a rate that they can survive on. When we look at the cost of living, and we just spoke about Medicaid rates being significantly low. So we have a workforce that's burdened because other providers in our community and within our state and country who could accept Medicaid and choose not to because reimbursement is so low, then we burden those providers who are accepting of it. But the facilities themselves can't reimburse to sustain the staff long term. We hear that all the time in our exit interviews.
Okay, thank you. Dr. Hoover, you've also touched on this, but I want to drill down on mental health in schools. Schools are often the only place that children can receive mental health care, but many schools lack the personnel and infrastructure to meet demand. What are the barriers that schools face, particularly when it comes to recruiting and retaining mental health providers?
Thank you, Senator Hassan, for your leadership on this and for the question. We know that we suffer the same issues that the general workforce shortage reflects as well. So simply put, we don't have enough providers, they're not trained well enough, and they're not paid enough. And what I mean by that really is that not only do we have shortages in workforce coming into the field, but they don't really represent the populations being served in terms of race, ethnicity, language spoken. So we have to do a better job of recruiting and retaining diverse and representative providers. They're not trained well enough. And what I mean by that is that we have many mental health providers, not enough, but many, but they're not trained to specialize in child and adolescent mental health, nor to work in schools. And as we've already said, they're not paid well enough. So reimbursement rates are a large issue. Again, I'd go back to that we also need to re-envision how we think about our mental health workforce and think about all of the other professionals and even non-professionals that can do this work well. I love the idea of a grandmother providing cognitive behavioral therapy to grandchildren, as our child psychologist or child psychiatrist, but Dr. Benton mentioned, but also our peer and family navigators. We need to be doing more to invest in that workforce as a way to support mental health.
Yeah, thank you. And I know in New Hampshire, peer-to-peer training and student empowerment has been really, really critical as well. Ms. Lebarsky, mental health resources need to meet children where they are. And during the school year, that's in the classroom, but mental health doesn't end when the school year does. So you've led an innovative program based on that insight, working with the Community Behavioral Health Association and the state government. Your clinic offered mental health training for camp counselors and provided on-site resources at summer camps throughout the state. So kind of following up on where we were just going with Dr. Hoover, what was the impact of this program and how can we scale up this model so that more children have support year-round?
So I was so excited about this program. Our Commissioner of Education labeled it Rekindling Curiosity, and it was really a means to tackle the mental health needs of students after being isolated from their peers. So we began last summer by training summer camp staff in recreation programs and camps across our state, and we're allowed to carry that funding into the school year. So we've continued to utilize it to provide professional development days to educators, to do youth mental health first aid training for educators. I have staff right now that are planning for February vacation week here in New Hampshire to go out and support young people to be maintained in camp settings or recreation settings that may otherwise not be able to be maintained because of their behavioral health needs. So rather than excluding them or expelling them from these programs, we have staff going on site, supporting the counselors and the youth to stay with their peers and really get a meaningful camp or recreation experience.
Well, thank you so much. It's a great program. Thank you for everything you're doing for New Hampshire. We really, really appreciate you. And last thing, I'm going to follow up, Dr. Benton, with a question on the record for you. I'm particularly concerned about the isolation of children who are immunocompromised right now during the pandemic, and whether there are specific ways we can help those kids. So I'll follow up with you on that. Thank you all. What an excellent panel.